here with Westside-Medical. Today we're going to go over some how to get mobility in your golf swing as well as strength. I even dressed like Tiger Woods today for the part. Stuff we're going to go over kind of is based off of some of the stuff that Sean Clement has on his YouTube page, Wisdom in Golf. I'm not going to get too technical with the overall golf swing. If you want to see some more stuff about the mechanics, visit Sean Clement's page. So first we'll talk about with your golf swing, as far as mobility goes, your core itself is almost like a barrel that doesn't move. So you don't want any rotation in your lumbar spine. You want this to be nice, strong, and stable. All the mobility comes from your hip joints here, which makes sense because like your femur head and your acetabular joint here, it's actually like a ball and socket. So you're going to get a lot more mobility there than from the lumbar spine. So in your swing, this is where the mobility comes from. Rotation right through here. So this is what you want to focus on for mobility. As far as the strength portion, you want to really focus on your posterior chain. The posterior chain is your low back, your glutes, your hamstrings. Because when you swing a club, like when you're through here to the hitting area, you're having this force that's pulling you forward. So you can only swing as hard as you can balance that centripetal force. So first let's talk about your hip mobility. What you need is you can get a band. I get mine from Westside Barbell. You need to attach to something. And then you can use like a weight bench, whatever. You can even do it on the floor. I'm going to demonstrate here with the chair. So you're going to put your foot through the band. Try it to fall over. You're going to work on your internal hip rotation here. So the band is going to pull this hip and this internal rotation. What it's going to do is it's going to really traction out this hip capsule. What you want to do is kind of just work it like this, going to work that muscle, kind of warm it up, and then sit and just let it sit there and hold. You want to do it for at least 2 minutes to make that tissue change. Anything after 2 minutes, we're going to get that actual stretching of the capsule, and you're going to get that increased mobility. Just hold it, work that stretch, and that's going to help you a lot in your backswing. You want to do both legs. Now that we've done the internal rotation, now we only want to work on external rotation. I used to do this by using a 25-pound plate. Start with 25 pounds, work up to 45 pounds. So I'd be here, you're going to lay down, there's the middle of that. It's going to put the weight on this hip and just let it sit there and sink down. And once again, you want to sit there and hold it for 2 minutes, and you really feel that hip stretch into external rotation. Sit there and hold it. It'll feel kind of like a cramp as you go because your muscles are probably not used to it. What you do is you're going to kind of just lift up like this, kind of work that hip joint, and let it sink again. Hold it and work it up. Let it sink, and just keep doing that. Minimum 2 minutes. You want to work both hip joints. And now we're going to go over here. We're going to talk about what I do to strengthen the posterior chain. What we have here is the reverse hyper designed by Louis Simmons. What this does is it's going to, as I'm going to demonstrate, it really tractions the low back. It tracks the low back to stretch all those tight muscles, as well as it really helps with your whole posterior chain as you go through the range of motion. So what we do in our office is we have patients, you can either hop up here, I'm a little taller, I kind of just jump on the machine. You want your hips here at the pivot point, grab through here, and so you're going to contract your lats also, which also works more of the posterior chain. Abdominal brace, and you're just going to go through this motion right through here. It's going to work the hamstrings, the glutes, the deep erectors that provide that stability in your low backswing, as well as the external rotator cuff muscles, and that lat. So work out probably about just a set of 10, and work up to about 3 sets of 10. When that gets easy, increase the weight, work up to about 4 to 5 sets of 10. For more information on the reverse hyper, visit us at Westside-Medical.com.